You've probably seen the headlines, Tylenol and autism, but Tylenol isn't the only medication that's ever been studied in this way to find out if there are links between a medication and autism or a medication and ADHD. And it's also not the first time that fevers have been studied in pregnant women either, and their link to autism and ADHD that have been documented. Autism and ADHD, regardless of what people will tell you, don't come from just one cause. They're complex with genetics, pregnancy complications, maternal health factors, and sometimes medications exposed during pregnancy that all play a role. When the media starts talking, it often makes it sound like there's a single culprit, but unfortunately, it's never that simple. Yes, recent studies do suggest possible association between prenatal Tylenol use and autism and ADHD. The FDA is looking at label changes, but that's about transparency, not about proof of harm. Tylenol is still considered one of the safest medications in pregnancy. And it's still considered one of the safest choices for pain and fever during pregnancy. One important thing to keep in mind is that association does not equal causation. So let's zoom in on what the science actually says about Tylenol and neurodevelopment. So you can start to see the nuance behind the headlines. One of the largest and most rigorous studies on this topic comes from Sweden. Researchers actually followed 2.48 million children and tracked which moms had taken Tylenol during pregnancy and which hadn't. In the standard models, they saw small increased risk of autism, ADHD, and intellectual disabilities in the exposed group. But then they did a sibling comparison. This compared two kids born in the same family to the same mom, where one was exposed to Tylenol and the other was not. And in that analysis, the risk disappeared. That suggests some of what looked like a Tylenol effect may instead have been due to family level confounders, things shared between the kids like maternal health, genes, environment. In another 2025 systemic review, they evaluated 46 studies using a rigorous environmental health framework, the navigation guide, and they found that many studies do show associations between prenatal acetaminophen use and increased rates of autism or ADHD, especially in high quality studies. The authors of these studies also explored biological pathways, things like how the drug crosses the placenta and the blood barriers, and how it might generate oxidative stress, disturb hormonal balance, or even tweak gene regulation in the developing brain. But the authors also caution the studies are diverse in design, including measurement and adjustment, making it impossible to give a measurement and adjustment, making a definitive answer impossible for now. And one critical wrinkle in the argument is the argument of fevers and infection in pregnancy, because many women take acetaminophen because they have a fever or pain during their pregnancy. But fever itself, especially during pregnancy, has been linked to neurodevelopmental risks. So when you see a study linking acetaminophen to autism, you have to ask, is the drug doing something? Is the drug doing something, or is it just a marker of the underlying illness? The Swedish study helps control for some of that, but there is no study that has yet perfectly teased apart the effects of fever, infection, medication, and external factors accurately or precisely. Regulation is reacting cautiously. In 2025, the FDA proposed updating Tylenol's label to indicate a possible association with neurological outcomes, not confirmed risks. Meanwhile, WHO and major maternal fetal health organizations stress this fact: the evidence is not yet conclusive. And professional bodies like ACOG remind us that acetaminophen is still among the safest medications for fever and pain in pregnancy, compared to alternatives with known greater risks. What do we walk away with? The evidence is intriguing and concerning enough to warrant attention and definitely more research, but not strong enough to start telling mothers or demand blanket rules stating that pregnant mothers can't take Tylenol or acetaminophen for fever or pain in pregnancy. The best approach is education, caution, and individualized care. If a pregnant person needs pain or fever relief, they need to talk to their provider about it and use the best effective dose that is considered safest in pregnancy for the shortest time possible. And never forget that untreated illnesses, especially fevers, evidence suggests, might itself pose a greater risk than the acetaminophen itself. Another part that gets overlooked is that the fever itself has also been linked to autism and ADHD. So if a mom takes Tylenol to bring down which factor is actually driving the risk? The fever, the medication, or both? The truth is, we don't know the answer for sure yet. Neither one has been studied thoroughly enough to say for certain. That's why it's so complicated and why the blanket statements won't work. Treating a fever may reduce risk in one way while raising questions in another. And the truth is probably somewhere in between. And other medications that have been studied are Depakote or valproate, which has shown clear, consistent evidence of higher autism and ADHD risk, and it's avoided in pregnancy unless it's absolutely necessary. There's also Topamax and Lamictal, and they have mixed evidence. Lamictal looks safer, while Topamax is less clear. And there's also SSRIs and SNRIs. Apparent links often disappear after controlling for maternal depression. And then for antipsychotics, There are fewer large studies and they are generally reassuring. And then opioids in pregnancy have been studied in recent high quality reviews, and they show no clear link to autism or ADHD when prescribed appropriately. The key takeaway is that every medication in pregnancy is about weighing the risk and the benefit. If the benefit of the mother taking the medication outweighs the known risk of taking the medication during pregnancy, then we have to do what's best for the mother and the baby with the evidence and the research that we have at that time, because that's all that we can do. And because the mother's mental health is affected by all of these things as well. And therefore the baby's mental health and the baby's development is affected as well. And aside from prenatal vitamins, no medication is completely recommended or 100% safe in pregnancy. Untreated illness, whether it's seizures, major depression, psychosis, infection, or even just a high fever, can be more dangerous than the medication. What matters the most is individualized decisions between the mother and her provider based on the mother's needs and the latest research, evidence-based research. So yeah, Tylenol has studies linking it to autism, but so does a fever itself. And so do several other medications. What we don't have is proof. That's why instead of fear-mongering and only delivering part of the story and throwing everybody into a frenzy, we should be giving the whole picture. We need to be honest about the facts that we know so far and about what we do not know for certain yet. Sometimes avoiding a medication is the safest thing a pregnant woman can do, but sometimes it's not. Sometimes not treating a mother's condition is much riskier than treating it. Whether it's seizures, depression, or even a high fever, they can all actually carry greater risk for the mother and for the baby. The most important thing we can take into consideration is informed decisions with a mom and her provider. We don't need to panic or spread misinformation or make mothers feel bad or pregnant women feel bad. Let's focus on clarity, not controversy. Facts, not fear. Thank you for being here today. I'll see you next time. Thank you for being here today. I'll see you next time.